Happy birthday to you. Happy birthday to you.
House calls in general serve an important purpose in that we bring care to people that would otherwise not get it. And so every time we have students, I say, we're going to see heart failure, we're going to see dementia, we're going to see amputations and strokes, and all these different people only see the doctor when they have an emergency. They're going to call 911 and go to the emergency room, and that is very disjointed. So there's no preventive medicine, there's no one preparing families for what they should expect. So when we come to the homes, we serve these people that otherwise don't get that preventive educational care. They just have Band-Aids put on their acute problems. And so any day of the week, there's 8 of us doing visits. And so if someone calls and says, my mom's coughing up blood, but her vital signs are okay, we can do an urgent visit that day instead of having her go to the emergency room, which would have been sort of the protocol. I would say in a visit, at least half, if not more than half of my time is spent with the caregiver, empowering, educating, instructing. This is how you change your wound. This is what I want you to call me for. These are the medicines. Here's what we're changing. That caregiver is the reason this person is going to do well. It's very soulful. I mean, we get to know these patients. We see them as people and in families. There's so much more that impacts someone's health instead of just the medicines they take, but the social aspects, the functional aspects, the economic issues that come up. And so why is your diabetic not doing well? You can see the fridge and you can see they're not able to eat the way that we want them to, and that's cultural, financial, all these reasons play into it. So I feel like it's a very important, easy way to take care of the whole patient and the whole family. And it's a huge piece, so you don't have to eat it all, maybe a quarter, and then Hattie can have a quarter. Is that okay? Once I did my first house call, I said, this is, when you're 3 years old and you dream about being a doctor, you don't think of, being rushed in clinic and, hurrying. This is the kind of doctor that I think all of us dreamt about being.